Empathy deficit disorder is a term coined by psychologist Michelle Borba in her book Unselfie, Why Empathetic Kids Succeed in Our All About Me World. Borba uses this term to describe a perceived decline in empathy among children and adolescents, which she argues is linked to various societal factors. Borba suggests that several cultural and environmental factors contribute to what she sees as a deficit in empathy. Technological and digital distractions. The rise of technology and digital devices has led to increased screen time and decreased face-to-face interaction. This reduced personal interaction can hinder the development of empathy, as it's often through interpersonal communication that individuals learn to understand and respond to the emotions of others. Social media and online communication. While social media allows for connection and communication, it can also foster a culture of self-promotion and superficial interactions. Some argue that social media platforms prioritize self-presentation over genuine connection, potentially leading to a decrease in empathy as individuals focus more on crafting their own image rather than understanding others. Parenting styles. Borba suggests that certain parenting styles, such as overly permissive or authoritarian approaches, can contribute to a lack of empathy in children. She emphasizes the importance of parents modeling empathy and teaching their children to recognize and respond to the emotions of others. Cultural values. Borba also points to broader cultural values that prioritize individualism and achievement over compassion and cooperation. In societies where success is often measured by material wealth or personal accomplishments, there may be less emphasis placed on the importance of empathy and interpersonal relationships. While Borba's observations have resonated with many people concerned about the state of empathy in modern society, it's important to recognize that empathy deficit disorder is not a recognized psychological or medical diagnosis. Additionally, the extent to which empathy has actually declined, if at all, is a topic of ongoing debate among researchers. Some critics argue that while certain societal changes may influence how empathy is expressed or perceived, there is limited empirical evidence to support the idea of a widespread empathy deficit. Others contend that empathy is a complex trait influenced by a variety of factors, and any apparent decline may be influenced by changes in how empathy is measured or understood rather than an actual decrease in empathic ability. Finally, empathy deficit disorder is a term used to describe a perceived decline in empathy, particularly among children and adolescents, which is attributed to various cultural, environmental, and social factors. While the concept has gained attention in popular discourse, it remains a topic of debate within the fields of psychology and sociology.